everyone, and welcome to this week's Sunday session with Sash. Thank you for coming back. If you're returning, if you're new, welcome, and I hope you enjoy this session. This week, we are going to be covering the topic of self-esteem. Like the other sessions that I've held with you guys, we went over one mental health issue or illness and relates to how it can affect your daily life. This week we're going over more of a topic of self-esteem. So I'm actually going to be covering several mental health illnesses or mental health disorders that can attribute to your self-esteem. And then I'm also going to be answering questions that you guys have given me. So I appreciate you for those questions. All right, so let's get started. As with every session, I start off with a disclaimer. As some of you may know, I am in pursuit of my master's degree in professional counseling. I have the professional knowledge and the ability to provide a diagnosis under the supervision of a licensed counselor. Statements made in these sessions are general information and are not personalized. For more in-depth information about personal treatment, please talk to your family doctor or a local counselor. If you need assistance finding these resources, I am available to help. My social media and email will be linked in the description below as always. Due to this being an informative platform, I am not responsible for any actions taken because of these sessions. If you or someone you know is in need of immediate help, please call 911. Also, if you haven't noticed, in the description box, I also link the National Suicide and Crisis Hotline. Again, if you know anybody that's in need of immediate assistance, call 911 or you can call the Crisis Hotline. All right, let's get into today's session. So, the 3 disorders that we are going to be going over that attribute to self-esteem include body dysphoric disorder, avoidant personality disorder, and narcissistic personality disorder. This may be a little bit of a longer session than you're used to and may be heavy with information. I appreciate if you guys stick with me throughout the entire session. Okay. So the first one we're going to go over is body dysphoric disorder. So for this disorder, somebody is preoccupied with one or more defects of their physical appearance that others are not able to see. So an example would be thinking that you're fat and you're actually really skinny, or thinking that your nose is huge, but it fits your face fine. Also, with this disorder, they have other behaviors such as repetitive behaviors of picking their skin or picking at the area that they're bothered with, checking in the mirror excessively, excessive grooming, reassurance seeking, like, do I look fat? Does this make me look fat? Or other mental acts like comparing themselves to other, like, oh, she's so much skinnier than me. I wish I was that size. In response to their concerns. So if they're concerned about their weight, then the behavior and mental acts that they engage in will be about their weight. Like all of the other illnesses we mentioned, in order for this to be a diagnosis, it has to be clinically significant distress or impairment. So that means that it has to affect their daily lives significantly, stopping them from going to work, going to school, engaging in typical activities like hygiene, caring for their children, or engaging in excessive activities like surgeries or extreme diets that aren't healthy, and impacting their health. The preoccupations cannot be better explained by another eating disorder. So another eating disorder that might come to mind is like anorexia nervosa, somebody who refuses to eat or eats very little to the point that they're starving themselves, or bulimia, where they binge eat and then eliminate after they have binge eating due to guilt. So if their symptoms are better explained by those disorders, then a mental health professional or a medical professional would diagnose them with those disorders first before body dysmorphic disorder. With muscle body dysmorphic disorder, they usually bodybuild a lot and gain on excessive muscle. Then there's also specifiers like with good or fair insight. So that means that they're aware that how they view themselves may not be all the way true, but these thoughts still reoccur in their mind. With poor insight means they're not really aware that their thoughts aren't as true as they seem. And then with absent insight or delusional beliefs mean they believe that their thoughts are completely true, no matter what anybody says or no matter what their body looks like. They have delusions usually that others mock them for their appearance. So if they are in a crowd and they hear whispering, they're like, oh no, I can't be here because they're talking about my weight, they're talking about my nose, whatever they're preoccupied with, they feel like people are always pointing that out. Due to this, they usually have high levels of social anxiety, and also just high levels of general anxiety and social avoidance. So they will avoid social interactions to prevent the thoughts of people mocking or ridiculing what is wrong with them. The prevalence of this diagnosis is that 2.4% of the individuals in the United States, of adults in the United States, are diagnosed with this disorder. 2.5% of that 2.4% is females, and 2.2% of that is males. Since the difference between males and females is very slight, for this disorder, unlike the other disorders we covered, there's no genetic no gender specifier. So like there's nothing that says females or males are diagnosed with this disorder more than the other. It's pretty even across the board. The most common age for this diagnosis is between 12 and 13 years of age. And if you think about it, that seems right if you think like we have in our other sessions about the course of life. At 12 to 13, you're probably going through puberty or have been in puberty for a few years, or you're about to enter puberty, depending on the person. And you're conscious and aware of your body changes, and you're not okay with some of the changes that are happening. For women, your breast and your hips start to develop. For men, you might start getting heavy acne, or your face is changing, your body is changing. The most prevalent ages, so where there's higher diagnosis, is the ages 16 to 17. And again, that's like still in the middle of puberty, and there's even more changes happening at that time. Now you're in high school and you're experiencing relationship changes. You may be interested in males or females now, or both. It happens with the elderly as well, but less often. Those who have an onset of this disorder before the age of 18 are more likely to attempt or commit suicide. And that's a very sad statistic. And if you think about it, kids are mean. So everybody's going through these body changes, but there are those children who will bully or pick on other children for being quote unquote different, not looking like what everybody else quote unquote should look like, what the media says they should look like. So there's a lot of pressure around that age. Some environmental factors that can increase the risk of being diagnosed with this disorder is neglect and abuse in childhood. So if in your childhood or in the childhood of an individual, they're not told that they're loved or that they're beautiful, or that they are okay the way they are, their skin is okay, the color that it is, if they're given the opposite and told that they're fat and they're ugly and you're too dark or you're too light or you'll never get married because you're so ugly, just abusive things, they're more likely to have this disorder, as well as physical abuse and sexual abuse, because they will question why they went through those things and they will blame it on themselves, creating the mental thoughts that they're not pretty enough, or they're too fat or they're too skinny. This disorder is pretty even across genders and cultures, so not one culture is more likely to be diagnosed with this than the other. I think the difference comes in between cultures of what is viewed as acceptable. So for example, in the African American culture, it may be more acceptable if you have a more curvaceous body. In the European culture, it may be more acceptable if you're thinner. And I'm not saying those are true. I'm saying these are maybes, but that's why it could be different across cultures. Some other mental health disorders that are likely to be diagnosed along with this disorder is eating disorders, because usually if the person has body dysphoric disorder or is unhappy with their body, they will engage in certain eating disorders to correct that. OCD, because they are occupied with the thought of changing whatever they feel is wrong. Anxiety, as we went over, because they are always thinking of others judging them. Depression, because they don't feel accepted. That is actually the most common co-occurring disorder. And psychotic disorders as well, because they have delusions in their mind of people viewing them as different. So that was the first disorder, and it was a lot of information. So, and I went through it pretty fast, again, because we had 2 more disorders to go through. If you have any questions about these, because I am going through them more quickly than my other ones, please leave comments, and I am more than happy to explain a little bit more. So the next is avoidant personality disorder. So this ties in with the social anxiety piece of self-esteem. Usually those with low self-esteem will avoid social interactions. So that's where the name of this disorder came from, avoidant personality disorder. So the diagnostic criteria include a pattern of social inhibition, feeling inadequate, hypersensitive to negative evaluation of others, and this also begins in early adulthood. So dysphoric disorder began more like in early childhood. This is early adulthood, so 18 plus. In order to be diagnosed with this disorder, you need to have 4 of the following. They avoid jobs or social interactions that involve interpersonal contact due to the fear of being criticized. They're unwilling to get involved in relationships or friendships with others due to the fear of criticism. They're resistant to intimate relationships. They're preoccupied their mind with being judged or rejected in social situations. They have inhibitions in new interpersonal situations due to feeling inadequate. And they view themselves as unappealing or inferior. And they're reluctant to take personal risk or engage in new activities due to the possibility of not being able to fulfill that responsibility or activity, or the possibility of embarrassment. It can start off in early childhood as shyness, but the reason why it says that it's not usually diagnosed in early childhood is because if you think about all children, they go through a shy stage where they're out in public and someone, you're meeting a friend and you say hi, and they hide behind you and look for comfort. Those are normal activities. Where it becomes abnormal is when that shyness continues to increase into adolescence and adulthood to the point where they avoid social interactions. It may be seen more culturally for those who migrate from other countries. And if you think about it, that makes sense because you're coming to a new country, or not even a country, maybe a new state, and you don't know anybody. So you dial back from social interactions. And people don't do the same things that you do. They're not interested in the same things maybe. So you have less social interactions because you feel like you'll be judged for the things that you like to do. This disorder also does not have any gender difference between the diagnosis of the two genders. Okay, so basically that's avoidant personality disorder. That is a shorter disorder. It requires less criteria to be diagnosed. But in a nutshell, it's somebody who avoids social interactions at all costs due to the fear of being judged or criticized. The next disorder kind of goes on the other end of the spectrum. So self-esteem has a spectrum. There's a normal, which is in the middle, where you have some positive self-esteem, but maybe there's just, something about yourself you're not 100% about. Like you feel like you could be thinner, or you feel like, you could be taller. Everybody has that one or a few things they would like to change about themselves. So the lower end of the spectrum is when you completely hate that thing about you, or those several things about you, to the point that you engage in dangerous or social inadequate behaviors to avoid being criticized or to change that characteristic. And then the other end of the spectrum is that you feel like you're better and everything about you is perfect, but to the point where your social interactions are not positive and you can't see beyond yourself. You think you are it and that is all, and nobody else can be as it as you. And that can have an effect on your relationships. So that is where we're going next in this discussion. And the mental health disorder that best explains that is narcissistic personality disorder. And I'm pretty sure you've heard of this disorder before, whether it be on a meme or social media or a TV show, that someone is a narcissist. So we're going to go into what that actually means and the criteria you need to meet in order to be diagnosed with narcissism. This is a short description, just like avoidant personality disorder. So, narcissistic personality disorder in an individual displays as a pattern of grandiose behavior. So that just means like extreme, over the top behavior. The increased or excessive need for attention, the lack of attention that you give to others, whether it be concerns or just general attention, and the lack of empathy for others. You can't understand how other people feel. This usually starts in childhood, and you have to have 5 or more of the following diagnostic criteria to be diagnosed with this disorder. So you exaggerate your achievements and talents, and you want to be recognized for those achievements and talents without actually commiserating the achievements. So something that was brought up on social media earlier this week is that you lost a whole bunch of weight and toned your body, but didn't do the acts to get there, like exercise or dieting. Now, there's nothing wrong with getting surgery if you want to change something, but attributing it to exercise and dieting when that's not how you got there, something like that. Preoccupied with fantasies including ultimate success or power, ultimate brilliance, beauty, and ideal love. So, and this is hard because I'm not saying that people who think that they're going to be successful and more successful than anybody in the world is a narcissist, but it becomes narcissism when it affects your social or personal life, and when you can't empathize with others, as we said, because of this preoccupation that you are the best and no one else can be better than you no matter what anybody does, and you look down on everybody who is different. You believe that you are special and unique, and only people that are as special and unique as you can relate to you. But the catch to that is you don't think anybody else is as special or unique as you. You require excessive admiration. You want all the likes and all the comments, and you'll do anything to get them. You have a sense of entitlement. You don't think that you have to go through the same process as everybody else in order to get something. You think it should just be given to you. And you take advantage of others in order to get to where you're trying to go. Again, you have a lack of empathy, and you're envious of others that have more, or you believe that others are envious of you for having more, and you're arrogant. So a lot of you might be sitting back thinking like, well, that's me too. The point is that you have to have 4 or 5 or more of these. So like, some people are arrogant and that's just who they are, but they still might empathize with others. So I wouldn't say that they're a narcissist. But you may believe that you're special and nobody's as special as you, but you don't require excessive admiration. So definitely take these characteristics with a grain of salt. I think it is good that we all believe that we are special and that we are unique and we're one of a kind. So just because thinking that you think that way doesn't make you a narcissist. Is when you have 5 or more of these, and like I said, it significantly impacts your life. So narcissistic personality disorder can be caused by vulnerability in self-esteem. So sometimes people upplay a lot how they feel about themselves when they actually feel way less. We see this with a lot of celebrities or people who are viral on social media. They actually have a lot of mental health issues or things that they're going through, which is normal. You're viewed by the world on a daily basis and you're expected to be perfect. And when you think that you don't meet that perfectionism, it can take a toll on your mental health. So this is a very rare disorder because only 0 to 6.2% of the population is actually diagnosed with this disorder. If you watch a lot of true crime, a lot of serial killers or psychopaths may have been diagnosed with narcissistic personality disorder. Yeah, that's all I'm going to say to that. But it is true that a lot of psychopaths and serial killers have this disorder. 50 to 75% of those who are diagnosed are males. Unlike the other disorders we've discussed today, this one does have a gender differentiation. And that could be due to a lot of things. It could be due to men thinking that they are alpha males. It could be a cultural thing where in certain cultures, if you're not a man, you don't speak to men. You will never measure up to a man, and so on. So a lot of cultural beliefs can lead to the presence of these symptoms and then lead to the diagnosis of this disorder. So it needs to be distinguished from mania or hypermania. And one of the disorders that we will go over in a few weeks is bipolar disorder. So one part of bipolar is when you go into mania, and that's when you have very grandiose behaviors, you have very impulsive behaviors. You might go out and buy a boat, and you don't really have the financial means to maintain a boat, but because you're on this high, you go out and buy a boat. So narcissism needs to be distinguished from mania, and the distinguishing factor is mania is usually a shorter lived, and narcissism is usually chronic, like it's their whole life. And as well as hypermania, so mania, hypermania, and substance abuse, because people who engage in substance abuse can also have these symptoms. But if substance abuse better explains their symptoms, they will be diagnosed with substance abuse before narcissism, because basically when that substance is not in use, they probably won't have these behaviors. Okay, so those are our 3 disorders, and we are almost at 30 minutes. Like I said, this session is going to be just a little bit longer than the other sessions, and that's because we're going over so much today. But I appreciate you for staying on. Next, we will go over more of techniques and skills to improve your self-esteem if you have low self-esteem, or to check yourself if you have really extreme self-esteem. Like any mental health illness or disorder, you want to identify your triggers. So if you know that when you eat unhealthy, it makes you think about how fat you are, and then your mind starts to spiral out, know that eating unhealthy is a trigger. So try to meal prep or try to make better choices when you're eating, and then it will reduce those thoughts of feeling inadequate. Become aware of your thoughts and beliefs. A good way to do this in therapy is to engage in what's called cognitive behavioral therapy. Cognitive behavioral therapy is designed to reframe your thinking. So when you sit down with a cognitive behavioral therapist, which can just be a regular therapist trained in that area, they will go over what your negative thoughts are, and they will work with you to reframe those negative thoughts into more positive thoughts by asking, are these thoughts realistic? Like, I'm the worst wife ever. I can never be a good wife. Is that realistic? What are some good things you do as a wife? And then you list out those good things. Okay, when you have those thoughts that you're a bad wife, refer back to these good things that you do. Maybe there's some things that you can improve on, and then you work on improving those. But changing the overall negative thought that you're the worst wife ever will help increase your self-esteem. So that goes along with challenging your negative or inaccurate thoughts, as well as adjusting your thoughts. You will go through that whole process when you engage in cognitive behavioral therapy. Many of the obstacles that you face with self-esteem are mental. And I don't mean that to sound bad when I say are mental, but I mean they're mental processes. So if you feel that you are worthless, it is in your mind. And changing your mind to have more positive input and more positive thoughts will change your self-esteem, as well as taking actions to change what you think is wrong. So if you do feel that you're overweight, engaging in exercise and dieting and changing your weight to what you feel is better will increase your self-esteem. Or if you feel like your skin is terrible, engaging and educating yourself on how to have better skin and then changing your skin will also increase your self-esteem. But at the same time, you should change your thought processes that I'm not perfect and the way my skin is beautiful, because just educating yourself and changing can cause extreme changes where you get severe plastic surgery to the point where nobody recognizes you anymore. So you want to make those changes in moderation, as well as changing your overall thought process. Engage in daily meditation, using our mind for good and giving it that relaxation period to focus on positive things is like exercise for our brain. So we're always on the go, boom, boom, thinking we gotta do this, we gotta do that. Taking that time to sit down and reflect, or don't reflect and listen to like rain sounds and just relax your brain will also give it an opportunity to work better. Okay, so those are the coping strategies. Now we're going to go into the questions that you guys have for me this week. So one of the reoccurring questions that I get is how to cope with triggers. And I think that I will include this in each session because it is asked often, and I understand why, because every mental health illness has a different way to cope. The best way to cope with self-esteem is to change your thought process. And if you're having trouble doing it on your own, seek a therapist and engage in cognitive behavioral therapy. Again, because it will help feed your brain more positive thoughts, but also change your thought process. How to combat symptoms of PTSD in regards to shooting and deaths in the community. I just wanted to reference this question because it is a very important question, and I want to save it for when we do go over PTSD, because that is a very broad topic, and PTSD is real, and it can be something as small as smelling a fragrance that you smelled at the time when a trauma happened, to bring that trauma back to you instantly. Cognitive behavioral therapy is also a form of therapy that can help with PTSD. Because PTSD is such a complex disorder, I always encourage somebody to seek counseling, because your mind is not playing tricks on you, but your mind is going to refer back to that trauma constantly unless you have replacement thoughts, and unless you actually process the trauma and grieve the trauma, your brain will continue to come back. Personally, I have overcome PTSD because of some things that I have been through in my life. And I can tell you from a personal standpoint that trying to do it yourself just drives you into a deeper hole. But when you go to counseling and come to the fact that you do have PTSD, and then knowing, again, identifying what your triggers are, that's the biggest thing of coping with triggers and coping with PTSD is, in any mental health illness, is identifying what your triggers are, so you know when those triggers happen, you can use your coping skills such as deep breathing, thinking about positive thoughts, meditating, to get you out of that mental state, because if not, you will go down a rabbit hole. So If you feel like you have experienced trauma in your life to the point where it's reoccurring and you can't get those thoughts out of your head, please seek a counselor. Poverty issues and mental health, absentee parents and mental health. Poverty and absentee parents definitely have a lot to do with self-esteem. If you ever heard of the cliche, she has daddy issues, he has mommy issues, it's not a cliche, it's true. If you grow up without a father, you are more likely to seek those father attributes in your spouse or in the person you are engaging with a relationship. And I may get a lot of pushback from this, but I'm telling you that it's true. And we will try to avoid that by saying, I don't want anyone that's like my father. My father did this, my father did that. But the thing is, you're looking for the exact opposite. Or you're looking for validation of why that parent left, why that parent wasn't there. I want to be careful of the things that I say because I know it's going to cause some ruffles, but it's true. And it's not your fault that your parent left. Your parent had their own choices and made their own decisions. But naturally, if the parent is not there, you will think that it's your fault as a child, and you may attach it to a physical attribute and try to change that physical or mental attribute. And you will also seek validation in others for the reason why that parent wasn't there. Those who are in poverty are, and I talked about this before, are more likely to be diagnosed with mental health illnesses, and it's because of the trauma and the stress that you go through in childhood. Your childhood is a very sensitive and molding time in your life. So a lot of times when you go to therapy, the first thing they will ask you is, did you experience any trauma in childhood? Did you experience, your father not being there, a death of a parent, or your mother not being there? Did you experience times without food? Because you're very vulnerable at that age. So anything little that happens in your life can manifest itself in adulthood, including coming out as self-esteem issues. Is it a mental health issue lying about how you changed your body? So we went over this a little bit, but yes. It feeds into that self-sense of validation. You feel like you need somebody to validate and accomplish you on losing weight or increasing a certain part of your body naturally, and that's not the way you went about it. Again, there's nothing wrong with getting body modifications. Some bodies cope with life different than other bodies. For example, women in pregnancy. Some women can have a baby and snap back, and they look like they never ever had a child. They can have 5 babies and snap back. Some people can have 2 children or 1 child, and it looks like they went through the worst. Their body completely changed. And there's nothing wrong with seeking medical help to change those things. But when you attribute it to something that's not true, like, oh, I drank this tea for 3 months and all of a sudden I lost 150 pounds. And it's not okay to also feed those lies to other people, because then when they try it and then that doesn't happen, that hurts their self-esteem. They feel like, well, why didn't it work for me? What's wrong with me that it didn't work for me, but it worked for her or it worked for him? And saying this may not help people realize it because, again, that's part of the narcissistic personality disorder, or just one of the characteristics is that they can't empathize with others. Well, I don't care that they feel like they're fat and that they can't lose weight off this tea. This is what makes me money, and this is what I'm going to do. It definitely is a mental health issue if you are attributing your achievement to something you didn't do. I mean, think about if a doctor who claims they're a doctor but they didn't go to medical school and they still practice medicine. That's a mental health issue. Like, you're delusional. That doctor has delusions, and not only does he have delusions, he could be harming people. He or she could be harming people. So, yeah. Those are all the questions and topics that I have for today. Again, I understand this session was a little longer than the other ones. I appreciate you for staying. I understand it also was a little harsher than the other ones because now we're talking about, looking at yourself and realizing things about yourself that you may not have realized before. Also, I just want to restate that these are general statements, and I'm not saying that everybody who has this characteristic has this disorder or needs help. I'm just stating facts and also characteristics that can lead to mental illnesses and how certain activities and events in your life can cause you to have more mental health issues. I hope this was informational. If you have any questions or if you want to know anything else about mental health, please leave a comment below. Feel free to email me or message me on Facebook. And I hope you guys have a good rest of your day. Thank you. Bye.